I'm Steve Wong, and I'm a data specialist, research specialist with the BRN. And we've been conducting the annual survey for about over 26 years. 2004, it was the annual school survey became a consolidated survey between the BRN and other stakeholders, specifically NEWAC, okay, education subgroup. And then in 2005 to 2006, we began contracting with UCSF, and the online survey administration began, and that's where we've been ever since. Next slide. Basically, when you do survey development and revise, you have to have consistent questions and current issues, which is what the annual school survey does. It has consistent questions, so we can look at trends, across time. We can also look at certain current issues such as simulation, and we also ask for feedback too, because basically you can, as you do the survey, you might want to give your views on certain questions that may be, you can write them in, and if you do that, then you can also submit them to the NEWAC Education Subwork Group to review, and they can give recommendations too. Next slide. So, we use the data in a lot of ways. I mean, employers use it for workforce planning. The state and federal agencies use it for data reporting. Law and policy makers use it for policy development. And of course, nursing agencies, educators, they all use them for various purposes. It may very well be the only source available for this data, so please fill this out as much as possible. And basically, it does provide evidence-based data for sound workforce and fiscal planning. The accuracy of data collected is important, so, you are always trying to do things to improve it. So, give us your feedback after you complete the survey, and we'll try and accommodate you. Next slide. Okay. I think you're going for, there you go. Back to you, Lisel.
Yeah, so a couple of weeks ago, we sent you an email with a link to all of the updated survey questions for the upcoming, or for the current administration of the school survey. And the survey is exclusively online. However, we do provide PDFs of the survey questions to assist you with data collection. And the survey questions are all available in PDF on the BRN website. And I'll show you how to get to that in a minute if you haven't accessed it already. And if you are unable to get to it, please email me and I will get you a link to the PDFs of the survey. We've broken it down into the separate segments, as well as there's one big document that's the overall survey that includes all the sections. And you will need to fill out a number of segments if you decide to download just those segments that are pertinent to your program. Last year, I think some people missed that a little bit and were surprised that there were some extra questions. So you will have to fill out well, I'll show you in a minute the things that you need to fill out, but you need to fill out, there's a couple of intro pages. There is a very important section on institutional information. There are, we've changed the survey a little bit this year, but there are some preliminary questions that relate just to sort of school-wide questions. And then there are specific program surveys for the different types of programs. So for instance, there is a generic ADN survey, there's an LVN to ADN survey, there's a BSN survey, et cetera, et cetera. So those are all available online. And let's see, for some people, it's best to have all of the information in front of them before they start. And for others, they can kind of move through the survey online. But I think a lot of people find it best to get as much of the data as possible ahead of time, since it's a long and complicated survey. Let's see. So you should have received your school's link by now. If you have not received your school's link to the online survey, please let me know immediately and I will get it to you. We have to individually mail the links from within the survey. And so that means that we have to mail them to one person, but I usually try to then inform all of the other people on the team that I know of about the fact that the links are out there and send them additional copies of the link if possible. However, it's important to remember that you don't want to share your link with any other school. You can share it within your school. I think it's supposed to be best to not try to have a bunch of people working on it at the same time. Haven't verified that yet, but I've been told that's probably a good recommendation. So this year, the online survey, as I said, is open now and available for schools to complete until November 15th at 11 p.m. So here is the survey time period. As I said, your survey link is customized for your school, and you can forward it to people at your school who are helping you complete the survey, but don't share it with other schools because they'll write over your data. And we are encouraging people that if you've received your link, please click on it and look at it, make sure your link works. And even if you don't continue with the survey from there on in, the survey should allow you to come back and get back into the survey, and your data should be where it was where you left off. The one caveat to that is if you enter survey data on a page and then you just close out, that page won't be saved. But if you fill out the data on that page and then click next page, it'll save it, and then you can close out and come back at some other time as long as you use that unique link. So the survey timeframes are listed here. So the survey time period for most questions, we're asking you for data from August 1st through July 31st. So for 2017 through 18, that's August 1st, 2017 through July 31st, 2018. And then there are census data questions, which are for October 15th, 2018. And people are always a little bit thrown by that, but we've just done it that way, and that is correct, October 15th, 2018. So that's a snapshot in time for both faculty and students. Okay. So this is just a copy of the, an email with a unique survey link. You should have received this by now. There's no username and password, and that's all you need to actually get onto your survey. So I'm going to actually try to see if we can do a little bit of a share of a live, see if it'll do it, a live version. And here we go. Okay, so this is a sort of a preview version, but I am going to just sort of go over this a little bit. So, most of you are aware that this is the intro page, and looks like a lot of boilerplate, but basically what this is your informed consent for completing the survey. So this tells you about your rights as a research subject and how we will try to protect your confidentiality. And so, it might be worth reading it before you click the next button. But you get this long, lovely page of procedures, risks and discomforts, benefits, etc. And by clicking next page, you're basically assenting to being part of our data collection. The next page after that is navigating the survey, which gives you some ideas about the different ways that you can get around the survey, which I'll describe in a minute. And a couple things that I wanted to point out on this page, though. Up here, we have links on the top of every page to the definitions we're using. So this should give you a little pop-up box that tells you about the BRN schools definition list that you can refer to. It's also at the end of the full PDF of the survey. The other item here is technical support, which should give you a pop-up box of the BRN website, or actually maybe this is our website, but anyway, a website that will answer common technical questions. The link to the 2017 to 18 BRN school survey on this is not connected yet, and I will see if I can get someone to connect that, but you can get to it through some of the other methods that I've told you. It's also, it should be right here, which is taking me out of the survey, I think, but you should be able to get to the PDFs of your survey here. And as you can see, you can get to the table of contents, the institutional information, the information that all the schools need to complete about their school in general, a special section for pre-licensure programs, and then there are separate program surveys here for both pre and post-licensure programs. So let me see if I can get back to my preview here. Let's see. So once I click this, I'm also going to note that at the very bottom of the page, there are some instructions here that tell you what happens and how you can get back into your survey, and that it will probably save your data up into that page. So when I click on the next page, okay, we got to navigating. It started me over again. Sorry about that. Okay, institutional information is a really important part of this survey. And of course, you want to provide your name, your college name, and it won't let you move forward if you don't. Also, you are going to want to click at least one pre-licensure or one post-licensure program before moving past the next page, because if you don't, it'll skip you out of the survey. There are various programming reasons why that is, and I'll try to work on that next year. But so I'm just going to say that I have, let's just say that I have an ADN program. So when I hit next page and I've clicked ADN program, it's now going to ask me this question in a different place than it did last year. It's going to ask it right here, do you admit generic students into your ADN program? And of course, if you click yes, yes you do. If you click no, then you have an LVN to ADN only program. And so it's going to say that I need to click that one of those. So if I don't have any post-licensure programs, I don't click anything here. But if I do, I need to select one of these. And as you see, I've added all this text about please make sure you select at least one pre or post-licensure program or it'll bounce you out of the survey after this next question. There is also a question about satellite programs, which you need to answer. And once you've done that, your survey gets sort of automatically set up for you to answer the sections you're supposed to answer and not any of the sections you're not supposed to answer. Okay, so there are a number of ways of navigating the survey, and they are, you know, we've tried this year. One of the reasons this has changed a little bit this year is that I had a lot of requests over the last couple of years that I started working on this survey to break the survey up into smaller chunks so that it was easier to go back and forth between the different topics. So this year, say you get in here and you have an ADN program and you look at it and you think, oh, holy moly, look at all the stuff I gotta fill out. Well, it's basically the same amount of stuff. It's just been broken down into smaller segments. So we're gonna see how this works. And I really appreciate your feedback on this because, you know, this was a little complicated to break the survey up, and I'm really hoping it works for people. If it seems too cumbersome, then we're gonna put it back the other way. So first off, the ADN section and all of the other types of programs have been broken down into these multiple sections that you can see on this initial table of contents that you get after you finish the institutional information section. So ADN and a lot of the other programs will start out with enrollment and admissions. There'll be a question about census and barriers to expansion. There's a special section on NCLEX review, completion and retention, clinical training and simulation, clinical space, and student loan debt are sort of lumped together because there's only one question on student loan debt. And then there's a section on submitting survey responses and a survey process questionnaire. And the survey process questionnaire is really useful to us because I do read these, every one of them, and you tell us whether the survey is better or worse than it was last year, how hard it was to get the different types of data, any technical difficulties you had. And then we have on the next page, open-ended comments that you can make to us, which I, like I said, read every year, which is why I change the survey a bit every year. But one other thing that I wanted to point out that's changed about this survey this year, and that is the pre and post-licensure general pre and post-licensure survey sections. So this year, because of some comments I had, especially from schools that have both pre and post-licensure programs, I changed the administration and staffing. So I put all of those questions together in one section for both pre and post-licensure programs. And for faculty information, I put all of those questions together. The only thing that's separate now is this section about pre-licensure student attrition, recruitment and retention factors, because that's only specific to pre-licensure schools. So let me just check here because I have a question on chat. You know, somebody wants to know how long it'll take to complete this survey. It really depends on how many programs you have. And I'll just note that the pre-licensure programs have a little bit more detail. The post-licensure programs have less detail. So if you have, say all you had was a doctoral program, I think this would be pretty quick. If you have an ADN program, usually you just have an ADN, but let's say you have a BSN and an MSN program, it's going to take you a bit longer to fill this out because you have to fill out multiple sections, and that can be a little more time intensive. There's a lot of information. So it really, the survey kind of sets itself up based on the answers you give in that institutional information section. So something else that I did want to point out is, you know, administration and staffing is replacing part of the general pre and post-licensure survey sections. And this is a section that I would appreciate feedback from you on because, you know, I changed it to try to accommodate folks who said that they were having to fill out the same data twice if they had pre and post-licensure programs. So we tried to put it into one section, but it was a little complicated for reasons that I'll probably point out. This right now is showing me that I have a, it's only showing me pre-licensure program director and asking questions about my pre-licensure program director because I only selected a pre-licensure program. I'll show you what happens if I restart the survey and say that I have both types of programs. So I'm just going to randomly pick a college. If it's your college and you don't have these types of programs, I know, I'm just kind of using it as an example. Let's say you have a BSN, and then on the next page, you have a master's degree, and you don't have any satellites, and you move along. And we get to this section, so administration and staffing. This time, it's going to show me boxes for potentially a pre and post licensure director. So if you have just one, just fill that out in the pre-licensure box, and that's okay, and leave the other one blank. If you have two, fill them both in. Then we have a new question, which is, do your pre and post licensure programs have the same director? If I say, yeah, it's the same person for both, and it's just going to ask me about the program director in general. If I say, and you'll see that I can go back in some parts of the survey. If it says, if I say no, then it's going to ask me questions about both the pre-licensure program director and the post-licensure program director. So that might be better or it might be trickier. So would appreciate feedback on that. And you'll also see that it's going to ask you two columns. So this whole question about what do about administration and staffing, and what does your director spend his or her time doing, and what percent amounts, is going to have a column for both the pre-licensure program director and the post-licensure program director. So another thing that I will point out that's changed a little bit is faculty information. Oops. So there are, this is a good prompt for me. A couple of other things that I should point out is that we've had a lot of comments about people are frustrated about some questions that don't allow you to move forward until you answer them. And that's largely because we were having some issues in the past with really key data points not getting filled out because people forgot to fill them out or just skipped over them. And so now we are trying to make sure that people fill out certain key data points. Also, some of them, if you fill them out, they shape the rest of the survey. So we really want you to fill them out before you move on. So right now it's telling me I have to total this question to 100 because, this question is a question that's supposed to total to 100. So I'm just going to total it to 100 in each of these just, to move myself along here. So there's a couple of them where you can't really get out until you've done what it told you, but then you can move on. Another section in here that's a little interesting is that we have tried to break down the staffing starting with assistant directors and clinical placement coordinators, clerical support, into separate sections for the different types of programs that you might have. So you can tell me whether this works or not. I have a section for when we ask how many assistant directors do you have, how many do you have that serve both programs, how many do you have that serve only pre-licensure, and how many do you have that serve only post-licensure? And so this one up here, the assistant director that serves both programs, that's not a sum total. That comes down here. That's just if you want to say that you have an assistant director that serves both programs versus whether you have one that serves only pre-licensure versus one that serves only post-licensure. So if I say I have one of these and two of these, it's going to shape my survey for me. And on the next page, I should only get questions about, I said I had one pre-licensure assistant director, so it's going to ask me about the hours for that person. And I said I had two post-licensure assistant directors, so it'll give me spaces to answer questions for both of those people. And then I will have columns for both of those. Okay, let me see if I can get back to, I want to also point out that the table of contents can be accessed in different ways. And I will get to some of the questions that are scrolling up in a minute or two here. You should be able to get to the table of contents. Oh, once again, I have to total to 100. Sorry about that. Okay. All right. Let's see if we can try that now. So one way to get to the table of contents is this little set of 3 bars up at the upper left. And that is going to take you to all of these different sections that you would be filling out if you selected BSN and MSN programs as your 2 types of programs. And I've also tried to note in here what questions are covered in these little segments, so that if you're looking at your PDF, you should be able to refer back. If there's any mistakes in terms of question numbering, let me know so that I can fix that next year. And another way you can get to your table of contents is down below. One thing I'll note is that this will tell you it's a kind of not totally accurate, but relatively accurate depiction of how far you are through each section. There is also this bar at the top that says how far you've gotten through the survey. Some people have said it's not very accurate. So not sure what to do about that, but they're rough ideas of how far you've gone through the survey. Whoops. Let's get out of there for a second. Okay, so next page, I'm actually going to go to here. So this also, down at the bottom of your page, there should be a section that this little bar down here next to the next page button that also will take you to a full table of contents, and it too will give you an idea of how far you've gone through the survey. So I'm going to look for just a second. Oh yeah, and I wanted to talk a little bit about the faculty information here. Okay, so faculty information, we again tried to agglomerate this. So we want to know what share of your pre-licensure active faculty also teach post-licensure students, which we've asked before. It's just in a little bit of a different place now. So if you have, 100 pre-licensure active faculty and 10 of them teach post-licensure students as well, that's 10%. We also ask you whether your nursing school has any faculty that teach post-licensure students only. They don't teach any pre-licensure students. And how you answer this particular question, number 11, will shape what you get for the rest of this survey. So if you have, let's just say you don't have any that just teach post-licensure, and I go to the next page, you're going to get questions about full-time active faculty that teach any pre-licensure students. So this doesn't mean only pre-licensure students, it means any faculty that you have that happen to teach pre-licensure students, whether or not they also teach post-licensure students. And you'll only get questions about those if you say that you don't have any faculty that just teach post-licensure. However, if you say that you have some faculty that teach post-licensure students only, you are going to get more questions that pertain to both the faculty that teach any post-licensure students versus the faculty that teach only post-licensure students. So that is a bit of a change. So if we need assistance, I'm going to read a couple of the questions real quick, so we might as well get to some of the questions before that gets too extensive. I'm going to have Stephen answer some of these too. Okay, if we do not know something, should we guesstimate? I think in some questions that's reasonable, but I'm going to check on that. There are some cases where, say, we ask questions like, how many of your students that graduated are working in nursing in California, and what % of them are working in hospitals? People tell me those are often a guesstimate, as long as it's a good guesstimate. If it's something you really, really don't know, you don't really have a good lead on it, I would say maybe leave it blank. Stephen, do you have a take on that?
Yeah, if you can, let's, basically, if you can guesstimate, but if you haven't a clue, then either contact me or Lisel, and then we can go on and sort of, walk you through it. But basically, if you can guesstimate, make the best you can.
Okay. Somebody wants to know, can we get access to our prior year survey responses? Yes, I can send them to you. Just email me and I'll go ahead and send them to you. Another person would like to know if we need assistance while we're doing it, is there someone we can call? And we've got some of our contact information on the first 2 pages of this survey. Of course, for the online version, once you're past them, you can't get to them anymore, but they should be on the PDF. You can definitely call me. I have, I think, sent people a number of emails with both my cell phone and my work phone on it, and also my email. Are there tools out there that track employment of our alum? I don't think so, but I actually am not sure. I suspect not. Stephen, do you know about that?
You would have to work with you to do that. Basically, there may be some surveys out there that do some things like that, but it's entirely voluntary once they're out in the hospitals, in the agencies. Basically, you know, it's sort of voluntary. We send it to them. So yeah, I'd want to talk to that person a little later about that one.
Yeah, because I know a number of people have asked or talked about the difficulty of tracking the employment status of some of the people that have graduated. So that's an interesting question. And another thing that I wanted to check back on with people, actually, because I just realized some issues with this particular question last year, is in administration and staffing. We've kind of played around with how we should ask these questions. So here, I'm going to go to the previous page, or I'll go to this page. So, there are a couple of questions about clerical support staff and clinical placement coordinator staff. And the clerical staff, again, we've broken this down so that we're trying to have all of the questions about both pre and post licensure on the same page. So let's just say you said you have one clerical support staff person that supports your pre-licensure and one that supports your post-licensure. And again, comments on how these questions are structured would be welcome. But so I'm just going to say this right now. So we're not talking FTEs here. We're talking about, a head count, basically. Even if the person works 12 hours a week, please put 1. And then on the next page, it should just ask questions about those two. And when it says hours per week, I'm going to give a better example. Let's say on the previous page, I have 2 clerical support staff for my pre-licensure, but 1 for post-licensure. So when it says, my pre-licensure only clerical support staff, well, that's 2 people. So I'm not, even if they both work 40 hours a week, I'm not going to put 40. I don't want the average. I want the total. So I'm going to put 80 for them. And my post-licensure clerical support staff person works 35. So I'll just put 35 in there. And then it will give me the total number of hours that you have dedicated to your clerical support. So again, in the first instance, we were asking for head count and not FTE. And then when we're asking about hours, we're asking about the total hours for all of the people you have in that type of position, not just the average. And let's see. Oh, we've had 2 directors in the time frame, and do we put in both names? I would assume that we would put in the current director. Does that sound good?
Yeah.
Yeah.
That sounds about right.
Right. Okay, and I'm going to scan a couple of questions here quick. So we've talked about the combined staffing. We talked a little bit about the faculty and the difference in the faculty questions this year around. And then we have, I think we took this one out. So let me just double check here. So I'm going to go back to the slideshow for a minute here. So let me do that. There are a couple of, and there are a couple of things that I should probably also mention, but let me get back to the slideshow for a second. And do that. Okay. Oh yes, okay. So I just wanted to put this one up on the screen briefly, and I can also show it to you live, but we added this question. Oops, doesn't want to do that. Okay, sorry, I'm gonna have to scroll through again. That one, okay. So, we put this question in last year. It's not a new question, but we have a new breakdown. So we are, the number that's asked in the first boxes are the number of students from each ethnicity scheduled to complete between August 1st and 2017 and July 31st, 2018. Items 1 through 4, so this year I numbered them to make it a little clearer. Items 1 through 4 should add up to the numbers that you gave in this first section on students scheduled upon admission to complete the program. So these 4 should, 4 should add up. Okay, but this last one completed the program between, August 1st, 2017 and July 31st, 2018, but behind schedule. That's a separate set of students. So just to make that a little clearer, I have done that. And so, yeah, check a couple of other notes here. And let me just check if there are any more questions as well. Okay. Okay. And somebody says they'd be very interested in tracking first-generation students. And is this something that can be added in the future? I think that the BRN group would have to decide that, but that's a really interesting and pertinent question. So we can make a note on that. Okay. Oops. And then I will open it up for more questions in a second here. And let me get out of annotation here. I wonder how that works. Okay. A little tricky here. I shouldn't have clicked on annotation. Aha, okay. And now it wants to hold on to my, apparently it wants to hold on to my little annotations. Let's see, how do I clear all drawings? Ah, there we go. Sorry, clear all drawings, get out of annotation. Okay, so again, the deadline to submit all survey responses is November 15th at 11 p.m. You will receive email reminders and which are kind of programmed into the system, and then phone calls if you've not completed the survey by the beginning of November. And you will receive an automated email with your survey responses immediately after submitting the survey. There was something that I was hoping to show people. I'm not sure I'm going to be able to get all the way through the survey to show it to you, but when you get to the end of your survey, you will get a series of questions that, of course, as I already said, ask you all sorts of things about how the survey went for you. And then you will be asked a couple times, like, do you really want to submit? Are you really surely done? If you haven't completed all those sections that showed up in your table of contents, it actually won't let you, it won't let you continue. Now, if you put in placeholders and then accidentally hit submit, it's going to submit with the placeholders that aren't real data. So if that happens, you'll get a call. But you do want to, if at all possible, once you get to the final page, there will be, and I may send a screenshot of this to everybody, there will be a little section that basically says, you're done now. And you can download a PDF if you want. And it's really odd because where the little button to download the PDF is way far in the, it's like about quarter of the way down the page to the right. It's a little blue set of letters that says PDF, but you really want to do your best to download that because that gives you a really good record of the data in a more readable fashion in case there are any problems, and you can save that. And sometimes it hangs up for a little bit, like it takes a while to download it. Like it can take up to, I don't know, maybe 30 seconds, maybe even a minute sometimes, depending on how fast your computer is. And then where it will appear, so if you are, let's see if I can annotate again. So the little PDF button will appear way down the page, like way over here. And then once you have downloaded it, what I'm getting lately with the new version of software that I have, it may appear differently on your computer. It kind of surprised me at first, was a little box way down here that says, you know, you have a file that's ready to download. And I kept looking for this file to pop up, and it was actually way down here, and then I had to click on it and download it. So, but it's a really useful thing. I can send you a PDF of your answers later, but it's in a little bit different format, so that's probably the best way to get it. And drawings, okay. So I might have actually done it. So this will be what you get when you're about to submit your survey. You will get a little check mark next to every section that you've actually completed. And if there's a check mark next to everything, it pretty much should be done. And then you're going to hit next page. And here it is, I'm sorry. So this is great. I did actually do it. So download PDF is going to appear way down here. You know, it's a little bit easy to miss. And then again, as I said, it's way down over here in the lower left-hand corner. Sometimes when I hit this, I'll get a little thing on my computer that says, you know, your file is downloading or it's downloaded. And then I, you know, click on that and it lets me either open it or download it. That may not work on every interface, but that seems to be working lately for my two computers. Okay, so I'm going to turn this back to Stephen and talk a little bit about the data products.
Yeah, basically, please try as best you can to submit the data by the deadline. I mean, if you can't, you can't. But there's going to be some point we're going to, have a final deadline, and it's going to be cut off because UCSF has to sort of look at the data, and we have to look at it too and see if it's, make changes, see if we can go and edit the data for accuracy and stuff. But we estimate there will be 2 pre-licensure reports around March 20th. There will be the data summary and historical trend analysis. We have an online dashboard that probably will come up in April. And then there's also, we'll post that the school level data on April 22nd. And basically there is a post-licensure report that comes in on June 28th. So, that's what we're going to get. We'll report that data to you and the public, and you'll be able to interact with the data with the new dashboard. Next slide, Lisel.
Okay.
And so, yeah, basically, if you have any questions, this is my email, stephen.wong@dca.ca.gov, Lisel Blash @ucsf.edu. You can download the PDF, on that by the link, and there's a link to the BRN website. And I guess that's about it, Lisel.
Yeah, and so if you have any questions, please feel free to contact us. I've been, fielding some questions from people that have been really great questions, and so we're happy to answer them as best as possible. And yeah, please make use of the website if you need any links or to the PDF, to the online survey, or anything else, please let me know. I have recorded this webinar, and I also have the slides should anybody need them. I know there were some people that weren't able to attend, and so they will be available. So are there
any other questions? Lisel, attrition basically means they've dropped out of the program or they've left the program. That's what attrition means, basically.
Yes, and that will be in the definitions that are either at the end of the big PDF of all of the survey sections, or also the one that you can link to online.
Yeah, for the person who says MSN program not matriculated students,
yes.
But you have students that applied or have been accepted. You can fill out some of that information, on the program. Some will be blank because, they haven't, finished the first semester. So, but as long as they've been accepted or applied, then you can fill out that information.
See, and so actually, is this person asking, so let's see, I might have to unmute you. Do you only need for the graduates or for everyone? Are you talking about the?
This for the nursing program, Ms. Just for the ADN. If your program is ADN, then you do need the graduates for the ADN program, not just not the entire school. No, just the nursing programs.
Are there other questions? Okay, I'm going to give it just a second, and then we'll probably close out. But I want to thank everyone for attending, and like I said, we're happy to answer questions.
If you have more than one nursing program, please report the graduates for each nursing program. If it's only ADN, then fine. Then just report only your ADN graduates.
I'm going to see if I can unmute the person that's asking the question.
Yeah.
Get a better description of what's being asked, and actually, if you are able to unmute yourself, please go ahead and do it. You might be able to.
I think you hit pound or something on your phone.
So now I'm scrolling through this very long list, and I know who you are. I just have to figure out where you are. Maybe not. So we might just need to talk offline a little bit about this question, unless I can find you within the next second or two. But I think that there may be more that could be clarified about that. Oh, here you are. Just a sec. I'm going to unmute you, and if you wouldn't mind asking the question, if you're on a computer, audio, or phone, or maybe describe what you need. maybe she's
Mhm.
okay.
Oh, well.
Okay.
Okay. We'll follow up on that one, Lisel. Yeah.
Okay, great. Okay, so thank you,
Okay.
everyone.
Okay. Thanks, Lisel.